Hi, I'm Krishna Gundapudi. I'm the clinical and professional lead for integrated care in St.Albans and Harpenden locality. We as a locality delivery group identified tackling obesity as a priority area for work. So from within our healthy weight working group, we conceived this idea of running lifestyle medicine course to address some of the problems that we are facing with obesity, and we termed it as a living well course. We went through some data sets and chose patients with BMI over 30 with one other long-term conditions, and we sent texts out to about 90 patients, and we had 20 places which got filled very quickly. We didn't have to put in much effort to fill those places at all.
Hi, I'm Dr. Richard Pyle. I'm a GP who specialises in lifestyle medicine and cardiology. And as an NHS GP, I spend a lot of my time really dealing with sickness, whereas here with my colleagues at the Living Well team, we've created a course that's really about promoting wellness. And it's aimed at people who are at risk of developing long-term conditions. It takes place over 4 weeks, and it's a mix of presentations, group discussions, and physical activity. And what makes the Living Well course special is that we look at all the different aspects of a person's well-being rather than just focusing on something like weight or movement.
I'm Dr. Payam Gadusi. I'm a GP with special interest in lifestyle medicine. During the 4-week Living Well course, our talks focus on the 6 main pillars of lifestyle medicine. That's purpose and meaning, connections, sleep, movement, nutrition, and stress and relaxation.
Hi, I'm Nicola. I'm a GP with specialist interest in lifestyle medicine. Over the course of 4 weeks, we've been looking, as we said, about pillars of the well-being and developing well-being plans that are really individual to every person that's attended. It's been lovely seeing people make friendships within the small groups and being able to talk about their own personal experiences and how these and how they're going to take all of this forward. Everyone's really enjoyed it and had the chance after the sessions to have a one-on-one with personal trainers within their small groups, and the chance to kind of take this forward from the 4 weeks with some feedback afterwards for the next couple of months. So it's been lovely to see that the people who've attended the course have kind of taken away from it their own individual wellbeing plans, a chance to kind of meet new people, and a real motivation for going forward for developing these further.
We stimulated some really good conversations about these 6 areas of well-being and potentially introduced some people to areas of well-being that they may not have thought about in the past, as well as briefly covering areas that we've all thought about improving in our lives.
So I thought the course was really very welcome at the time. At this time, it's very hot outside, but I needed to do exercise, and I've never been to a gym before, so it was good that we had instructors to show us how to work the equipment and in beautiful surroundings. The talks in the morning before the gym were very useful, especially about well-being, sleep, and how to de-stress, the importance of food, especially. It seemed to be more important what you put in your mouth rather than exercise. So I'm going to concentrate on eating later in the morning and earlier in the evening. I realise at this time, at my age, it's really important to look after my health because I don't want to become another statistic of illness.
It's been an interesting three weeks because unfortunately I missed the first week, but it's been interesting to learn a little bit more about meaningful wellness and meaningfulness, and especially the sleep session today has been good, but it hasn't sent me to sleep, so it must have been interesting.
It's been a very interesting 4 weeks. It's something that I wasn't looking forward to be honest with you, when I first started. But everybody focuses on the food and side of dieting and whatever, but this brings together everything that's required. The mindfulness, the stress, the sleep, the food. It brings together everything and highlights a lot of things that you probably weren't even realising were correct and doing things incorrectly. So it's really, really good. And then the gym sessions afterwards, as you can see, they work you to the level that you want to work out at. But also as well, if you are carrying injuries, they've been very, very good in explaining how you can get over things, how you can still do things with an injury, and how you carry an injury without injuring yourself. So overall, it's been an excellent course. thoroughly recommend it, and been a big eye opener for me.
I've really enjoyed the session, so it's been really good fun just coming along. And what I liked about this course is not so much that you were told what to do in terms of losing weight, what to eat, but actually given the tools to achieve these things. So that was really good. And the gym sessions afterwards were a bit of an eye-opener to me, because I think my brain's been overprotective of how much I can push myself, but the training guys here pushed me way beyond I ever pushed myself. So that was really interesting. But all in all, yeah, great course. Enjoyed everything about it.
It was a brilliant collaborative effort, bringing together stakeholders not just from the viewpoint of St.Albans District Council, leisure operators, and the NHS. We also had Hertfordshire County Council involved, and it really showed the importance to all of these entities to making sure that health and well-being is a priority throughout the district. And I just want to thank all partners and participants. And hopefully this pilot is going to be the beginning of something being rolled out wider, and just something beautiful. So I just want to thank everyone who was involved and look forward to seeing you next time.
So looking at the feedback that we have received today from all the participants, it appears that the program has been quite successful, and of course we will take some time to see the results of this, but the feedback has been excellent. We would like to roll it out across the locality over the next 1 year.